Good morning. If you have decided to study to become a professional hypnotherapist, keep watching our training videos about hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. Trance induction methods in direct clinical hypnosis. Situational method. It is called situational technique because it starts from the environment, situation, that surrounds the individual. To begin with, we'll focus on the following points. To focus all his attention on himself and his environment. To focus and be aware of himself and himself. Self-awareness. Adopt a comfortable posture and a position that is comfortable for you. Arms stretched along the body, hands loose and relaxed. Close your eyes and pay attention to everything around you. To do this exercise, you'll have to use visualization, imagination, and memory. Auditory situational awareness of your surrounding, of recognition of external noises. Noises such as telephone, car noises, motorbike noises, people talking, the clock, etc. Of course, you have to be aware of all the noises that may be present to include them in the process. Very good. Pay attention to everything around you. You're going to pay attention, first of all, to the noises, to all those noises that can disturb you during the session. You're going to pay attention to the noise of the telephone ringing, noise of motorbikes, of people talking, noise of cars. Parking of the recognized noises. Put them in a place in the brain and leave them there. Now that you have recognized all those noises that can be annoying and distracting, you will take them to a place in your brain. You will put them in a corner, and in no way will they annoy or distract you. Take some time to collect the noises very well. Put them in the most hidden place in your brain very well. And now leave them there and forget about them. Those noises no longer belong to you. So that now, all the noises, you'll continue to hear them. And even if you hear them, you will no longer be aware of them. Focusing. Focusing attention on your own breathing. Good. Now, nothing external bothers you. So, you are going to focus your attention on your breathing. Focus your attention on your breathing. And you are going to bring all the air you breathe in into your stomach area in such a way that the chest will be completely still. You'll feel the stomach area swell. You'll hold the air for a few moments and finally expel it. And as you expel the air, you will enter into a greater state of relaxation and rest. So breathe the air in again. Feel your stomach area swell. Hold your breath a little. Very good. Now breathe it out and feel the sensation it gives you to be more and more relaxed. Repeat it several times, shorten it and trying to adapt the speech to the patient's rhythm. Breathe in, hold your breath a little bit. Very good. Now breathe out, and as you breathe out, utter to yourself the words relax. Breathe in the air. Hold the air a little. Very good. Now breathe out, and as you breathe out, pronounce to your inner self the word relax. Breathe in, hold it in. Very good. Relax. Now that you are calm, safe, and relaxed, you will pay attention. Just listen to your breath. Listen to your breath. And when you hear it, let me know. Let me know by moving a finger on your hand, right or left. Repeat this until you indicate with your finger. You do not always get it right the first time. Okay, now I'm going to count from 3 to 1, and as I count, with each number I count, you will enter a deeper and more relaxed state. 3, 2, 1. You are now in a deep state of relaxation. Relaxation. We can use for this the first relaxation pass of the protocol, the one we have been applying in the clinical hypnosis session or the deep hypnosis session. Clinical hypnosis. 1. Feet. 2. Lower legs. 3. Upper legs. 4. Hip. 5. Stomach. 6. Chest. Breathing. 7. Shoulders. 8. Upper arms. 9. Lower arms. 10. Hands. 11. Neck. 12. Head. 13. Face. 14. Eyelids. 15. Jaw. Deep hypnosis. 1. Feet. 2. Ankle to knee. 3. From the knee to the hip. 4. Hip and belly. 5. Back and spine. 6. Chest. 7. Shoulders and neck. 8. Arms and hands. 9. Head, face and jaw. 10. All that is missing. Now, relaxed as you are going to focus your attention on your feet. Focus your attention on your feet and watch as the muscles of the feet relax, relax, loosen and loosen, so that the feet become relaxed, loose and pleasantly relaxed. Relaxed and loose as the muscles spanning from the ankle to the knee, getting softer and softer, more relaxed and relaxed, so that the calf is now more relaxed, looser and pleasantly relaxed. Now you focus on the part that goes from the knee to the hip and feel how its muscles relax, loosen and distend. Feel now how the things are now more distended. Now you focus on the part that goes from the knee to the hip and feel how its muscles relax, loosen and distend. Feel now how the thighs are now more distended, looser and pleasantly relaxed. A little higher you find your hips, resting gently and comfortably, all the muscles surrounding the stomach loose and relaxed, the stomach loose, adopting a comfortable and relaxed position. Now you focus on the spine and your back and find it totally attached to the stretcher, resting quietly and comfortably. as well as the area around the chest. Relax it and feel it loosen and relax as the breathing slows down, more leisurely, more comfortable, calm, easier, pleasantly relaxed. The shoulders in a comfortable and relaxed posture. The muscles surrounding the neck loose, relaxed, and pleasantly relaxed. The muscles of the arms relaxed and distended, and how the arms giving distended, loose, and pleasantly relaxed. The hands and all their muscles loosen and distend, and the hands also that give loose, distended, and pleasantly relaxed. The head rests gently and quietly, the muscles of the face relaxed, the face distended and pleasantly relaxed, and the jaw slightly ajar, so as to prevent the teeth from touching each other. Visualization. Focusing on what is closest and most familiar, in this case, the house. Now, you are going to use your imagination and you are going to see with your inner mind's eye, visualize that you are standing in front of your house. It is your house. You see it every day, so you know its size perfectly well. So you know perfectly well its size, the color. You open the door and little by little you go to your room. You are in front of the door of your room. You open the door and you enter your room. It is your room. You go there every day, so you know it very well. You see the bed. It's your bed, the furniture, the details of your room, the quilt, the pillow. You've had a tiring day, so you're getting more and more tired. You're getting more and more tired, more tired, more tired. So tired that you feel like lying down to rest. So I'm going to count to 3. On the count of 3, you lie down as long as you are. 1, 2, 3. You drop like a stone. You lie down and relax. You relax your feet, legs, thighs, waist, chest, shoulders, head. Now you're deeply relaxed, so rest, 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 and tire, and tire, and tire. Now the therapy. This can be extended as much as you like, depending on the patient's condition, by taking the patient to other places in the house beforehand and ending up in his room. This will always be places that the patient knows very well and sees every day. Summary of the technique. First, situational auditory awareness and isolation of the patient from all external elements that may disturb him or her during the session and obviously noises outside. Keep in mind that hypnosis is a concentration process. Second, programming indicates that you will continue listening to the noises, but this will not affect you at all. Third, auditory suggestion. Focus his attention on himself and fundamentally on his breathing, abstraction. Diaphragmic breathing, interior. Start the suggestion when you feel the breathing. Fourth, Suggestion: count from 1 to 3 and indicate your deepest state of relaxation. Fifth, relaxation. Diaphragmatic relaxation has the advantage of producing endorphins that produce tranquility, while thoracic relaxation produces oxytocins that enhance alertness. Sixth, location. Place the person in a place that is well known to them, in this case, the door of their home or any other place. Note: it is important to know that when we carry out an interrogation and the patient is in a hypnotic trance, the questions must be dictonomous. The questions must be dictonomous or at least limited. Yes or no? In a concrete question: high or low, trees, warm or cool, breeze, etc. Color, size, in short, any type of questions that makes the individual not have to think, since in the practice of hypnotherapy, the patient is in a trance, because in the practice of hypnosis, it is not necessary to let the individual think. At this point, it is expected that the patient is in the third state of relaxation, deep. If this is the case, the key would be applied and we would go directly to the therapy. If this is not the case, we will be given other deepening resources to achieve this before applying the key. Obstacles. The main obstacle we may encounter when trying to put this technique into practice is the excessive rationalism of the patient. Considerations to take into account. A. Do not mention at the beginning of the session that you are going to relax. It could put the patient in prevention and attention to be attentive to what is happening. B. Do not mention the word "I want you to" and replace it with "now we are going to," or "now you are going to proceed to," or "now you are going to." C. Indicate that you are going to use your imagination rather than telling him visualization. This way, you induce him to think that it is not about seeing with the eyes of the face. D. Keep in mind that there are 3 types of people when it comes to hypnosis. 1. Visual, visualizations. 2. Kinetic, producing a sensation of movement. 3. Audiovisual, music and visualization. E. At the end, understand that a hypnosis session is not more or less than a well-done story. If you're interested in learning more about clinical hypnosis, watch our next video, Methods of Trance Induction in Direct Clinical Hypnosis. Both methods. Remember the description of this video where you can find a link to free training classes on clinical hypnosis. And also you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much.